Hello and welcome to NHIS in a Week. We are coming to you from the Palace of the Okrapehene, where we bring you highlights of NHIS activities at the Odra Festival at Ekropong in the Eastern region. In the headlines, NHIA pays homage to Okrapehene at this year's Odra Festival. Head of Administration of Tetekwashi Memorial Hospital lauds Equiapim Chief's initiative to enroll 5,000 people onto the NHIS. Center for Plant Medicine Research call on NHIA to extend health insurance cover to patients who resort to the use of herbal medicines. Now to our top stories. Some management and staff of the NHIA, led by Deputy CEO in charge of operations, Mrs. Vivian Adokobia, paid homage to the Okrapehene, His Royal Majesty Osiadia Yokwesi Ekufu III, as he sat in state to receive donations and well wishes at this year's Odra Festival. The Equiapim Overlord, in collaboration with the National Health Insurance Scheme, sponsored the registration of 5,000 people from various towns in the Equiapim Range as part of the Chief's goodwill gesture during the season. The exercise, according to Mrs. Adokobia, will help drive the NHIS target of attaining universal health coverage by 2030.
Health insurance here what target to achieve at the end of the year. Then again, you can say a bois, not Ghana and so universal health coverage. I don't know, you can see any on hene, and I see any on my money in a boom. Now, you know, Eddie and so. Now, yet me register on members. Now, see it me back, now say any or hene ebedin como, or kukwamuni abonte. Now, so no should be too jack. Say, ne man nina, ne man money no. Omo and register no mo health insurance card. Say the be ya wo betima show ma pomu den. If you say nipa ho den a, e mo mamu ni nyina agina. Enu nti na ne ye tutu anamon aba abebom from national. Ye ne ye district scheme abeka bom. Ya ba be pay homage ama Osiadia yo.
The manager of the Equiapim North NHIS District Office, Mr. Charles Owusu Nkrumah, indicated that his staff are working overtime to ensure that the Okrapehene's initiative of having 5,000 natives registered becomes a reality.
I can say you register 5,000. You need your home. It's your target to achieve, but your operational, calendar you follow. However, I say we have a special program. I didn't you have insurance. You can boom. Any I Equiapim Mahine, and I have 13, 14 communities. You call your mandate. You started was so last Thursday. Now every community be able to be on your target you achieve, and no near monochrome, and then an answer, and your Presby JSS. You better ask why or channel or channel you ever. You better ask what you tell you ever could see a brew and in a chip, Yababia, or you Equiapim Mahine. I mean, the traditional jurisdiction, you be in our view. Tina and Niji, ever answer my, universal healthcare as well as your targeter. I was here achieve for the year, no.
The Deputy Director of the Membership and Regional Operations Directorate of the NHIA, Mr. Oti Frempong, has charged traditional leaders to replicate the gesture of the Okrapehene by enrolling community folks on the NHIS, revealing that the target of his directorate is to have a total of 18.3 million active members on the scheme by the end of the year 2022. Mr. Oti Frempong stipulated that group registrations such as those organized by the Equiapim Chief is a sure way to get the numbers onto the scheme.
Directorate, Membership and Regional Operations Directorate, no. Ye tuosi ye say afi ebeko da wie no. Na ye timi ama edipa 18.3 million active cars. Na kakra da na ye hwese by 2030 ye betimi achieve USC no. Enti jumadi ekoso ha no eyadia eso mboba ye pa isan say sa kwan so nye betimi afa enye numbers no enche bia ne regions ni nyina eye meeting kakra the bebre na kire say omo wa fashe say yam festival ekoso wo voter region ni ade ni nyina no ebo modin ha say because support you obodo so betimi anya nipa do na enim say nipa do na na say botai de esi enu say afi be kwa wie ni yatimi anya 18.3 no ni yatumi anya.
The NHIA Eastern Regional Director, Dr. Edward Kujo, has hinted that the scheme is poised to register everyone in the Eastern region by the year 2030. He admonished health providers to stick to the contractual agreements they have with the NHIA in order to eradicate the challenge of illegal payments members of the scheme are faced with.
There were other irregularities in terms of illegalities charging people when they go to the hospitals, even though these services and the medicines are actually covered. Yet people are being charged. Because of that, the CEO, Dr. Okoboy, has taken it upon himself that this canker has to stop. So as we speak, a committee has been formed throughout the nation to make sure that we take care of this issue. We are collaborating with all the facilities, so not just only the National Health Insurance. We are making sure that all the facilities involved that are credentialed or accredited, they are all into this so that we will stop this canker where people that are not supposed to be paying anything are charged with illegal monies. And so we believe that from here on, these illegalities that is causing people to say that the National Health Insurance is now working is going to be the thing of the past. And we are extremely serious about that. And we are going to have a collaboration with our stakeholders. It is not that we are going to impose something, but we want to make sure that this is a contract. It's a contractual agreement that we have with the facilities. So that if it is in there that you are not supposed to be charging someone for the services that are being paid for, then definitely it is within our limits to make sure that you don't do that.
And moving on, the head of administration of the Tetekwashi Memorial Hospital in Akuapem Mampong, Mr. Maxo Labi, has lauded the Akuapem chief's decision to enroll 5,000 of his people onto the National Health Insurance Scheme, saying that it is the wisest decision ever in terms of health delivery in Ghana. Mr. Labi reassured the Akuapem chief that the Tetekwashi Memorial Hospital is ever ready to provide healthcare services for any of the existing or the newly registered members under the National Health Insurance Scheme.
It's very, very good initiative that he has undertaken. And I think it's the most, I would say, the wisest decision he has taken concerning health delivery. And this number, 5,000, is going to increase access to health to benefit the people over here. And we, as management of Tetekwashi Memorial Hospital, we are ever ready to attend to such clients if they visit us over here.
The Deputy Executive Director of the Center for Plant Medicine Research, Dr. Daniel Boama, has hinted that plant-based treatment centers such as the Mampong Center for Plant Medicine Research and other accredited centers have longed to have the NHIS cover treatments they give to people, especially those covered by the scheme. After several years of pushing for the inclusion of herbal treatment on the scheme to no avail, Dr. Boama called on the management of the NHIA to consider the plant-based medicines and treatment industry in the next revision of the NHIS medicines list, so as to enable patients who fall on the traditional medicines approved by the FDA for treatment of illnesses to also enjoy full health insurance cover.
We've been pushing that through the ministry, that if this can also be part of the health insurance, to cushion those who patronize the herbal products a little bit. And people come here and they ask, do we accept a health insurance card? We tell them no, the government is considering it. So if this comes to effect, it will be very helpful. As the days go by, the cost for treating or the cost of using herbal medicine is going up. So somebody, for instance, coming to take medicine for malaria treatment will have to pay more than somebody who is going to government hospital for malaria treatments.
Up next is Health Tip. This week, we take a look at mental health issues. This is how we wrap up this week's Odra edition of NHIS in a Week. For more of these stories, do log on to our website www.nhis.gov.gh and our social media platforms for more. My name is Vida Edichumwa Boating. Thanks for watching.